Hello, everyone, and good morning, good afternoon, or evening, depending on where in the world you're joining us from. I'm Henry Bonsu, host of The Threshold, a foreign policy podcast about how to end infectious diseases. I'm excited, I really am, to be your moderator for this virtual dialogue on World NTD Day, a topic near and dear to my heart for both personal and professional reasons. Neglected tropical diseases, or NTDs, impact about 1.5 billion people, or roughly 1 in 5 of us. They can cause chronic disability, stigma, and death. Despite their scale, they are underfunded and underprioritized. They also affect the most disadvantaged populations. Today, we are focusing on what's next in the fight to eliminate NTDs, and we'll hear more about one key sector in particular: pharmaceutical companies. They play a unique role in treating and preventing neglected tropical diseases. Some of the biggest pharmaceutical companies have donated key drugs to treat NTDs. From 2010 to 2025, pharma companies donated over 30 billion, I said billion, not million, billion tablets and vials, and it's helped a lot. The number of people needing interventions against NTDs has dropped 32% since 2010. But, as we all know, global health funding is drastically declining, putting all this progress in peril. So, where do we go from here? How do we keep up the momentum to end neglected tropical diseases? Before diving in, I'd like to extend a big thanks to the Gates Foundation for helping make this event possible. We'll also publish an edited version of this conversation as a bonus episode on the Threshold podcast. That'll be next week. We release our first season this fall. You should check it out if you haven't already. Anyway, I'm sure I'm not the only one with questions. We also want to hear from you, our audience, tuned in and watching our live streams on social media. We've reserved a portion of this event for questions from our global audience. Here's how to write to us. If you're watching the live stream on our website, click the button below to submit your questions. Please be sure to tell us your name, organization, and where you're writing from. If you're joining us on social media, you can chime in by tagging at foreign policy, or you can email us your questions to events@foreignpolicy.com. Okay, let's get started. I'm delighted to introduce our two guests today. Sabena Solomon, Vice President and Head of Global Health Access at GSK, a multinational biopharma company based in London. Welcome to you, Sabena.
Thank you, Henry.
Good to see you. And let me welcome Sam Macintosh, Vice President of Global Strategic Partnerships at the END Fund, a leading philanthropic community working to end neglected tropical diseases. Sam, thank you very much for joining us also today.
It's a pleasure to be with you both.
Thank you very much. I'm going to start off with you, Sabena. Let's think big initially. Let's frame this whole thing. You have been, both of you, in this space for a long time. I'd love to start by hearing from you, Sabena. What inspires you to work on NTDs?
Well, I think it's such an inspiring space because there are so many people working together with one vision. If we look at lymphatic filariasis, which is one of the NTDs that we're talking about as an example, we can also see that there's been a significant progress that's happened in NTDs as we move forward. That is quite a rare situation in the global health space. So we've really seen that it is possible to move towards elimination in the countries, and we can see a significant reduction in the requirement for drug and medicines. And that is why we're all here, is to help people get better. And that is so inspiring for everyone who works tirelessly on global health matters, including neglected tropical diseases.
Fantastic. A quick follow-up. I mean, from your perspective, what have been some of the biggest achievements towards ending NTDs in the last few years? Because, of course, there has been progress.
But there has been. And I'd say, so in 2024, 21 countries have managed to eliminate lymphatic filariasis as a public health problem. That's amazing. With about 69% reduction of people who actually need mass drug administration according to the WHO. The only way that's been possible is by so many different people coming together, and GSK being one of the number of those organizations, along with the NFund and others, who work with the WHO for lymphatic filariasis. Through our long-standing medicine donation to the WHO, we've been able to donate over 12 billion doses of our antiparasitic medicines for NTDs. And they've been distributed to over approximately 1 billion people. Sorry, the
Wow.
numbers are just crazy.
Distinction with a
1
difference.
billion.
Yes.
Exactly. But over the last 25 years, and for me, this isn't just about numbers. I was really reminded about the individuals that make a difference here, whether it's the healthcare workers or it's the people receiving the medicines. I was in Zanzibar seeing that 12 billionth dose being given, and it was given to a wonderful woman in Zanzibar called Mezole, sorry, excuse me. And it really changed her life and her daughter's life, who was her carer as well. It really reflects on the power of the coordination and the tireless efforts of everyone working to the one vision.
Thank you, Sabena. Sam, I've been looking at your bio in detail as well, and you've got a long track record in this space, working in various parts of the globe. Explain where your drive comes from and what inspires you to work in this neglected space.
Hmm. Well, I think that's changed over time, Henry. I'd echo everything that Sabina has said, but since I became a father, it gives you a different perspective on things too. I mean, these numbers truly are staggering. If we look back to since the London Declaration on NTDs in 2012, which was, of course, a pivotal moment, bringing together pharma in a new and more significant way, with collaboration from endemic country governments, donor governments, and philanthropists and others. 700 million people or so fewer require interventions than they did before. It's just a different way of looking at the numbers you've talked about
Yeah.
already. And, I find it, frankly, even as somebody who works in communications, quite difficult to stay connected to numbers that are that big. And so I do personally find it very grounding on a regular basis to think about what this means for families, what this means for children. If we look at the impact of either lymphatic filariasis or another disease, intestinal worms, soil transmitted helminths, that the antiparasitic donated by GSK also treats. A deworming of a child has an impact that ripples throughout an entire community. And if you think about even just one child and all of the people who care about the well-being of that child, you start to get into some quite big numbers very quickly. It's not just in that household, it's their friends, it's their community, it's their neighbors. And you multiply that impact by 700 million, and this is one of the things that sets NTDs apart in the world of global health. The sheer scale of the impact. It's not just about this being a public health initiative, providing treatments, eliminating a disease. It's truly about the betterment, the prosperity of families and communities at a huge scale.
Yeah, you've both interestingly pivoted from the macro to the micro. I mean, Sabina talking about her experience being touched by this person receiving treatment in Zanzibar. How far do you get out to actually see the impact on the ground yourself in the flesh?
Well, for me, not enough at all, honestly. So there are so many people affected by this every single day. Um, I've been very lucky to see some really interesting programs where they're combining different disease um, together. So, for example, in Uganda, there's a really great example where they bring all the childhood immunizations and childhood support together in one place, so that families, communities don't have to travel miles to get to a health clinic. And for me, those are the places where you see the impact that Sam was just talking about in families, for children, for people not having to give up a whole day's worth of work or take their children out of school. I've seen a number of situations, and for me, the impact is greater and greater every time. And it doesn't take too much effort for us to help change a life
Yeah.
or help reduce the stigma for people, but we can do a lot more.
Exactly. And Sam, before we continue, I mean, do you manage to get onto the ground, or for you working at a senior level in comms, do you see the achievements in the grand scale as opposed to in micro on the ground in a town or village where you're trying to eradicate, say, guinea worm?
Yeah, no, it's very much both, Henry, and I think it's very important to maintain that dual perspective and ground decisions that can feel big in scale in the impact at a micro and a local level. The End Fund is a vehicle for philanthropic collaboration. And when we look across the various philanthropists that we represent and whose resources we have the privilege of stewarding towards these goals, it's very often a family decision to invest. It's not, it's not just one person ticking a box in a sort of a chart. This is very much a personal journey for many of the philanthropists who we represent, and their families are very often involved. And so we take that very seriously. I've had the privilege of joining philanthropists, their families on many visits to programs to better understand the nature of how their investments are having an impact, and also to learn about new challenges and how we can adapt and continue to evolve how we are allocating these resources. So since I've been with the End Fund, that's been an incredible privilege to join them. And I think coming back to that perspective as a family, it's something that's very grounding and a real leveler. I've accompanied senior executives, CEOs, politicians with significant influence on visits like this. But the one thing that truly finds a level ground between everyone is that family perspective. I've also had the privilege earlier in my career of sitting inside ministries of health, helping to design the kinds of quantification tools that can more accurately determine how many drugs are required to deal with any given disease in a country. And, that is another, place where it's really important to maintain the dual perspective, because on the one hand, you can sit with a spreadsheet, you can, figure out how to optimize resources, etc. But when you think about how that translates, and this is where I come back to the value of the drug donation programs, it's not just a number of pills, it's not just a health intervention, it's what that donation enables health systems to be able to allocate the scarce resources at their disposal into other areas to help the very same communities in a variety of different ways. So maintaining that dual perspective, I think, is critical.
Very good. Now, so I'm going to stay with you for now because you've mentioned a range of organizations, entities. You've talked about ministers, so we're talking government, talking about family foundations, we're talking about philanthropy. But of course, in the NTD space, pharmaceutical companies play a key role. Why do you think contributions from these big, well-resourced, well-experienced companies, the pharma companies, are so critical to ending neglected tropical diseases? Because people say, well, why should it be for the private sector, profit motive driven companies to be doing this? It should be government, it should be public sector.
Well, Henry, it's a great question, and actually one I can answer quite simply. And it is that these donations are critical. They're quite simply critical. They're the foundation upon which decades of collaboration and investment, all the collaboration that Sabina was talking about earlier in terms of all the different entities required to help deliver programs, all of that collaboration and cooperation is built off of the foundation of these. Coming back to the reasons why the End Fund was founded, we were founded in 2012, the same year as the London Declaration, and in large part because of the leverage created by these large scale drug donations. In any health service delivery, the cost of medication is very often the highest or one of the highest unit costs. And so when you take that off the table, every dollar, every penny of philanthropic investment that goes towards delivering those goes significantly further. So, we say very often in our sector it costs less than 50 cents per person per year to deliver these donated drugs. In actual fact, we have data that shows that it could be very significantly less than that. And that's because of the economies of scale that are achievable given the scale of the burden that picture you painted at the beginning, but also the how effective and how efficiently this global movement to end NTDs has really become over the last few years. So, I mean, it's a truly sort of remarkable collaboration, but it's something that, is underpinned completely by the value of these donations. Had these not started 20 years ago, 30 years ago, in some cases longer, would the level of philanthropic investment be there today? Almost certainly not.
Yeah.
And that is something that needs to be remembered, needs to be celebrated. But I think we can also leverage that as we look forward and think differently about what sustainability looks like, what sustainable access models look like. We need to think differently about how to leverage the value of these investments from pharma.
Very good. Thank you. Let me pivot back to you, Sabine. I mean, NTDs are a big part of your global health access portfolio at GSK. You've been doing this for a long time. Tell us more about the company's work on this, GSK's work on this, and how it differs from other diseases in your portfolio.
Yeah, so I would say at GSK, our overall mission for the whole organization is to unite science, technology, and talent to get ahead of disease together. And I think that mindset is critical in NTDs. Getting ahead of the disease really means that we're aiming for elimination of lymphatic filariasis as a public health challenge. We're supporting for soil transmitted helminths or STH, so it can become under control for the countries. And it can only be achieved by different sectors and different people working together. So I would want to say, so yes, GSK have been in this for a long time and a lot of donation, but we're not alone. Other pharmaceuticals are very much involved in this. And I start the name check, but I'm sure I'm going to miss some. So whether that's Merck, KGA, MSD, Eisai, J&J, et cetera, Sanofi, Novartis, Pfizer, etc. Everyone plays their part. And I think that's why I'm very proud to be part of this industry, as Sam said, to kind of engage with others. And to date, GSK alone, I've mentioned, we've already donated more than 12 billion doses. But this is something that we continue to be committed to, because when it comes to product donations, that's just one part of what we do. We're actually really pleased that the number of donations that are required year by year is declining. And that's because of the gradual elimination or the further control of the NTDs in this space. But that's due to the efforts of everyone coming together.
Yeah.
We really feel it's really important that partnerships and joint efforts continue in this space. And as they move forward, we've certainly got other agreements in place of support that's going out there for the end fund for sure, but also working with other organizations to help define and further move forward the country-led solutions and support to make sure that supply chains are robust in those countries. So we're really happy that we've been working alongside the Gates Foundation, WHO, and others for 25 years in this space, and look forward to supporting going forward as well.
Yeah, interesting, Sabina, you mentioned country-led because although a humble journalist based in London, I do go to an awful lot of international health-related events at the World Health Assembly, of course, in Geneva, the World Health Summit in Berlin, the WHO Afro meetings, whether it's in Brazzaville or Lusaka, and people always talk about country ownership, and they say, well, if health funding from whether it's the US or multilateral organizations is going down, the countries have to step up. They have to meet the challenge. And even before all the global health cuts last year, some of which we're anticipating, funding for NTDs in particular, Sabina, has been in serious jeopardy. Just looking at some figures, between 2018 and 2023, the amount of aid towards NTDs declined by, and here's the figure, 41%, which is huge. What do you think, staying with you, Sabina, should be the pharmaceutical industry's role in this fight, particularly at this moment? Because some players will say you need to deliver more if others are backing off. But what do you think?
Well, I think anyone listening to this will be aware that these challenges are wide across the global health space. It's not just NTD. So I think there's a bigger situation at large here. And for me, it's really the abrupt approach of this funding cut that's really had impact. So for GSK and for the other companies, I think it's about remaining committed to our global health efforts. Certainly at GSK, we support NTDs, but also TB, malaria, and HIV through ViiV, as well as supporting vaccines through Gavi and UNICEF, and our ongoing R&D pipeline to make sure that we can get full access strategies. So I don't think any one organization can step up. Yeah. It's about how can we work together, continue the effort, and really do support the countries who have been wanting to take that ownership and accountability from way before these cuts came in. Yeah. It's something they've always had this ambition to do, as WHO, AFRO, the African Union, etc., have been stating for many, many years. This situation just increased the urgency to help them really get there, and coming together is really essential. So for me, let's not forget about building those resilient health systems, making sure that any support that we give has a lasting impact in those countries, and make sure that it's really not dropped because of this funding issue that we can see in this area. Because for me, it's really important. We've talked a lot about pharmaceutical companies and other organizations. None of these programs would have had the impact that they have had if it wasn't for the country level healthcare workers, many of whom are volunteers, amazing, mainly women out there who can really make sure that they implement programs like for NTDs, for lymphatic filariasis and others, to really reach those populations at the last mile. And for me, it's how do we make sure we can support countries, have continued surveillance, find those communities, make sure we monitor and evaluate and understand what's happening in the world, so we can bring together that breadth of experience and really help the countries go from strength to strength. And that takes us all, not just one group, in my view.
Yeah, it's true what you say about the community health workers, often volunteers, women in rural areas, often remote, because when I go to these events, the Kenyans in particular are keen to show me what they do in their counties, and it's quite impressive. And Sam, in your last answer, you sort of touched on the End Fund's unique role in this whole ecosystem when it comes to that pipeline, particularly supporting service delivery. So given the backdrop that Sabina has just sketched out, what's your thought on this? Where do we go from here?
Well, I think, I think we've said 58 countries have eliminated at least one NTD, some several. And that is an incredible milestone to be achieved. Now, the World Health Organization has set the target for a global community of reaching 100 by 2030. Now, this presents a dichotomy because, of course, you think scaling up numbers, scaling up programs requires more resources exactly at the time when we're looking at fewer resources in the sector. And so we have to think differently about this. And I'm so glad you asked the question, Henry, about country leadership, because that has to lie at the center. I think it's a term that is, we've all been supportive of in general, but it can mean very different things in different contexts. But I think one of the things from the End Fund's point of view that is critical is to help support governments to think about what their priorities are today and tomorrow, rather than think about supporting programs based on perhaps incentive structures and partnerships that have been in place for a long time, many years, if not decades, that are perhaps built on a system that will not be around tomorrow. And so one of the most important things we did last year was to support the African Union Commission, the Africa CDC, to convene all member states across the entire continent to do a new sort of very robust micro planning and costing work for a 3-year period, so that together as a global community, first of all, we're listening, we understand exactly what the priorities are from when it comes to NTDs in every country. Second of all, that there is one plan and one budget that is determined by the countries themselves, that is then articulated by the regional bodies and shared with the global community. That allows us as a philanthropic vehicle to ensure line sight and stability when we are engaging with philanthropic donors, who, by the way, in the NTD sector represent a disproportionate volume of total resources from philanthropy as compared to other parts of the global health sector. It's critical that we maintain, and it's critical to the trust, but also the how we optimize and steward the resources that we're entrusted with, that we are working with the same information and plans that are relevant for how countries want to adapt to these shifts, both today, but also looking over the course of the next few years.
And I mean, this is really important, how to integrate better with national healthcare, because people have been talking about country ownership for a generation with patchy results. And what are some of the end fund's lessons on this? How willing have countries been to listen to you, as well as all the other partners who are banging on and in their ear saying, listen to us if you want this money?
Well, I think the point I was trying to make, and I'll reiterate, Henry, is that it's us who should be listening to the governments and to the
Right,
communities. And
right.
so, and it's really part of our job at the End Fund to help ensure that we create a space that is trusted, that has the right data, that is informed with the right information, but also we can bring the right people. I mean, the convening power of the End Fund is one of our strongest assets. Regardless of how much money is raised in any given year, our ability to bring together partners from the pharmaceutical industry, from endemic country governments, from local implementation partners to philanthropists of all shapes and sizes around the world, if we can bring that group together and center their conversation and their focus on the current and the future priorities of the communities who we are all at the table to serve, then that is our role. That is our job. And so, of course, this is a complex thing. It takes time. The idea of sort of finding a methodological alignment across so many different countries and contexts, and the nature of the programming is at different stages, etc. Of course, there's a huge amount of complexity, but there's actually simplicity at the heart of it as well. And that is making sure that everyone is at the table for the right reasons, and they're there to listen to the communities who are affected by NTDs and the governments who represent them.
Thank you, Sam. Sabina, do you have a further perspective on how NTDs can be better integrated into a country's healthcare system? You touched on some of this, but you may have further things to say.
Yeah, and I totally agree with Sam. It starts with listening. But I think if I were to add kind of 3 points, I think the first one is about embedding NTD services within the existing in-country primary health care services within the national health system. Today, there's a lots of parallel streams. So how can that become embedded so it can really become sustainable? And for me, it's about taking the services out to those who need it most. It's making sure community healthcare workers training is integrated. We can see that depending where the support comes from, there's different training for different diseases. Let's have one. We're certainly working with a few other companies and gates in Ethiopia for integrated healthcare worker training, and that is including NTDs within that whole mix. And we can really see when countries are bringing in NTDs within other programs. For example, Madagascar have brought NTDs in with polio. You can see the impact that they can have. So that embedding within the existing services is really key. I think the second piece is about strengthening the cross-sector collaboration and building more capacity to make sure we can have impact for NTDs. And I think that's exactly what Sam has talked about here. So the how do we support that micro planning, the capabilities, and the development in countries? They know what they need. They probably just need us to help us make it happen. And the third one, it probably should be in the first one actually, is community engagement to address the stigma that exists and to ensure the sustainable uptake of programs. It is all about the power of people. We see with people, even after they're no longer infectious, they are seen as a little bit aside. They're not
Yeah.
incorporated within communities. They're not always welcome back of their women to get married or to have a full kind of career or work or go back to school. It's really tough, but that is something that we can help change. They're my top three.
Tremendous, Sabina and Sam. We're just over halfway through our conversation. We've got lots of people tuning in from around the world, and thank you very much for your kind attention. Let's remind people what we've been discussing. We've heard both about Sabina and Sam and their drive and why they do this, why they're so engaged, why they're so active, why they're so optimistic, both at the micro and the macro level. We've talked about the general role of big pharmaceutical companies and family foundations as well. The key important point about delivery, it's all very well having the medicines, but it doesn't serve anybody if they're in a remote part of Zanzibar or in a remote part of some county in Kaptagat. Kaptagat is in Kenya. That's right. I was thinking Kaptagat was in Uganda. But my Kenya or Ugandan friends will correct me if you're tuning in and you're alert. But it's really important to feed that pipeline. That point about delivery that both Sam and Sabina made. We talked so far about the funding challenges, the devastating reduction in the amount of aid towards NTDs of 41% between 2018 and 2023, and who should step up to fill that gap. Some assume the UN somehow, this amorphous organization, will step in if nobody else will. Some say, well, what about those partners who haven't put in much money thus far? If the reliable old partners, say in the Western Hemisphere, are saying we need to look after our own countries, our own taxpayers more, what about some of the others who say we are now a reliable partner? If they're not coming forward, if there's radio silence, then what should the end fund be doing? What should GSK be doing? Can they do more? Can they do things differently? We're talking about collaboration as well. We'll talk about that in a bit more detail in a moment, and also integrating better with national care, healthcare, because we talk all the time about country ownership. Now, if you want to respond to one or more of those topics, if you want to ask a question of Sabina or Sam, here's what you do. Just to remind you, click the button below to submit your questions. Tell us your name, organization, and where you're writing from. If you're joining us on social media, you can chime in, just tag at Foreign Policy, or you can email us your questions to events@foreignpolicy.com. That's events@foreignpolicy.com. Let's talk, Sam, about collaboration, because we like to talk at the World Health Summit or the UN General Assembly or the World Health Assembly about better partnership, better collaboration. And your organizations are talking about a deeper collaboration. I'd like to hear the details. Sam, do you want to go first on this? Deep collaboration, we want this.
Absolutely. Thanks, Henry. Yes, today we are thrilled to share that we will be embarking on a deeper collaboration with GSK. Now, we have been a part of helping to deliver a huge portion of those 12 billion doses over the years that Sabina talked about before. And so, as we think about what kind of collaboration is required for the challenges of today and tomorrow, instead of how things have been for the last 20, 30 years, we need to think differently. We've covered that already. And so why I'm so excited about, truly actually thrilled about this collaboration with GSK is that, for the first time, it represents GSK. And Sabina's talked about the various ways that not just GSK and other companies are giving and supporting governments. So this represents yet one more way. First of all, they are investing in the pooled fund mechanism that the end fund brings to the sector. So what that means in very pragmatic terms is more resources available for governments and communities to help get the job done. So when we talk about NTD elimination and lymphatic filariasis that Sabina mentioned before, we know the elimination pathway exists. The science is there to back it up. And we have the structures and momentum in place to support countries embarking along that pathway. But what we need is more resources to help more countries get along that pathway faster. And GSK are coming to the table yet again to help to do that. Second of all, with soil transmitted helminths, the other disease that their donation helps to treat, the scale of the burden is even greater. It's something that is disproportionately affecting children. And so the delivery platforms are different. And we know that the elimination pathway is more complex because it relies more heavily on things like improved water sanitation and hygiene programs and infrastructure in countries, which frankly are goals that will simply take longer to achieve. And it's not that we don't understand how to do it, but it's a different pathway with a different curve. And so that is where GSK are coming to the table yet again in partnership with the End Fund to join the conversations that we talked about before to think differently about what sustainability can look like. We know that the current commitments exist through 2030, and I think it's 28 billion doses have been donated across all pharma companies for this decade alone. And I think the easiest mistake that we could make would be to simply say thank you very much and rest on our laurels because it is not enough to simply say thank you very much. We need to, and we may already be behind the curve in thinking about what happens after 2030? What happens, the next day? How are we making sure that these commitments are going to translate into effective and appropriate mechanisms to transition away in a thoughtful way, in a way that is grounded in the realities, but also the priorities of countries themselves to transition away from full donation and think differently about different access models over time. So we're very excited to work closely with GSK in supporting governments to do that through this new collaboration.
Thank you very much indeed, Sam. And I like the way you said GSK has stepped up again, which is great to emphasize that. You're not fatiguing, you're determined to stay the course. Sabina, can you describe the collaboration from your perspective, from the GSK perspective? How do you see it working?
Honestly, I think Sam has covered it
Yeah,
so perfectly. I think just from my side, it, all I'd add it's about that coordinated co-investment. It's so essential. And actually, the fact that the N Fund can make this happen with different resources in the country level. We know what medicines can make a difference. We know the pathway. We know how to do it. We know who needs it. It's about getting it done.
yeah,
And this will hopefully help move it forward. And part of that is also about advocacy and communications as well. People need to know that it's possible, that it's available, they can make it happen. And the N Fund can do that through this additional support. And I really think right now we need to focus on impact
yeah.
and make sure that access is available for everyone who needs it. And we need to really accelerate our efforts at this period. We know the WHO roadmap goes to 2030, and making sure, as Sam said, we can find the appropriate way to transition to help countries be ready at that point to take on those pockets where they need to take it on, and making sure that they've got that full appropriate surveillance in place. Because the worst thing in the world would be, after we think we've had some successes, is we find that because of a lack of appropriate surveillance, there are still communities that are suffering needlessly.
Thank you very much indeed for that, Sabina and Sam. And as you've, I think, both alluded to, when and this is my experience, when you go to these big events, particularly in, let's say, Lusaka or Brazzaville, I've been on Botswana in Gaborone to the WHO Africa regional meetings, the elephant in the room is domestic resource mobilization. So, your own taxpayer base in order to fund your own healthcare. Lots of, sometimes even ministers don't really want to talk about it for too long because sometimes health ministries are the Cinderella when you look at the big spending departments around the cabinet table at country X or country Y. And let's hear from you both before we get our first question from our audience. I'm going to start off with you, Sam. What do you think that is the best approach for this? What kind of discussions do you have with spending departments like health ministries on that difficult topic, but the elephant in the room of domestic resource mobilization, taxes?
Yeah. So I think, Henry, the key here is looking at this from the perspective and from the shoes of a health minister. And the people who are leading that department have to create and justify a budget to the finance ministry, planning ministries, etc. And it's in that justification. It's learning about how to speak the language and talk about the value of achieving this. I think many people who are tuning into this who understand a little bit about NTDs, and hopefully this conversation is going to help them understand more that achieving the NTD roadmap goals WHO has set by 2030 are probably some of the more achievable, maybe the most achievable global health goals that exist by 2030. Because as Sabina said, we know what to do. We have the tools, the pathways are in front of us. It's just about getting the job done. Now, that's not enough when we're talking about how to justify within the context of a national health budget, because of course there are too many other priorities to deal with. And so, how do we think differently about this? We need to look at it from the perspective of this is not just a health issue. This is an education issue. It's not just an education issue, it's an economic issue, and frankly, a foreign policy issue. And there are a lot of ways that you can look at the value of achieving NTD elimination. There's Nobel Prize winning literature out there to tell us that the value of deworming a child in terms of future productivity. There's a lot of studies out there that talk about the hundreds of millions or potentially billions of dollars of productivity that could be unleashed if communities were living free of NTDs. Now, it's about the right data and putting it into the right tools in the hands of the right people within these processes to be able to justify these expenditures, not just because they'll achieve health outcomes, but because they'll help boost the prosperity of the country and the economy. I think that is one really important way to approach that question.
Thank you very much, Sam. Sabina, you'll be very familiar with the Abuja Declaration. And of course, the countries who signed it are supposed to spend about 15% of GDP on healthcare. Very few countries achieve it. What about the conversations that you have as GSK, your perspective on domestic resource mobilization?
Of course, for us, it's all about the investment in health. This is where we need to focus. It shouldn't be seen as a cost. It should be seen as what can we do to make a difference, to make sure people are happy, healthy, and really have a future opportunity to be part of their society. That is the focus where we engage. What can we do with our scientific medicines, vaccines that are out there to help this happen? For me, I think there is a lot to be said about the more we can use the tools in our tool bag, the more we can help educate and support others to become advocates in this space. We can help children go to school and stay in school and not have to come out because, unfortunately, of a neglected tropical disease that they didn't need to contract. Or it can help people stay at work. This example, for example, of this wonderful woman, Mazole in Zanzibar, who I met, her daughter was her carer. And because of that, both of them weren't able to go to work and make money. They weren't able to become economic citizens of their communities. With the medicines that we can support, if they get to the right people, that can change it. So therefore, if you invest in health, you can support local economic resilience and have healthier populations and stronger workforces and communities. That is the argument that people should be thinking about.
Thank you, Sabina. I think I'm going to make you minister if I ever have the pleasure of forming a cabinet. Right. We've got questions coming in from around the world. I'm delighted to see. We can start with Ellen, who's in Pennsylvania, I think. Ellen, welcome to the program. And she says this: most of your discussion has been focused on delivery of medicines. What do you suggest for funding the development of newer drugs that are expected to have greater efficacy against certain parasitic worms? Thank you. Thank you for that great question, Ellen. I'm going to start off with you, Sam. So Ellen has been following and tracking the discussion, but she wants to know about funding for the development of newer drugs that might be more effective against certain parasitic worms.
It's a great question. Thank you, Ellen. And that, in fact, has happened. Over the last few years, we've seen tremendous efforts, and these are more examples about how pharma investors are coming to the table in new ways, augmenting their long-standing commitments for large-scale drug donations to also invest in developing, for example, pediatric formulations of the same drugs but that are more efficacious and more effective for younger populations. And so we've seen that with Johnson and Johnson's product, actually. We've also seen it with Merck KGaA in Darmstadt, Germany, produce a drug called praziquantel to treat schistosomiasis or bilharzia. And recently they have formed a consortium that has helped to develop a pediatric formulation of that to treat younger children. It's a smaller pill size. It doesn't taste as bitter. There's for so many reasons it's going to be more palatable and more effective in reaching those young populations. So there are a number of these examples across other disease areas and other companies as well. So it is happening. And these are exactly the kinds of innovations that, we need to be, the fact that we hadn't covered that yet actually is a shame. We need to be highlighting that more, and it needs to be part of how we leverage the broader commitments from pharma rather than just these historical large scale donations.
Thank you, Sam. Sabina, what would you add to that?
I think Sam's covered it very nicely. I think the only other thing is their continued research efforts across the space for global health, and it remains really important in this funding challenging environment that we're in. We need to encourage ongoing grants for research and development, and to encourage everyone to continue to be part of this ecosystem. It is really important across global health.
Yep, thank you very much indeed. We have a question, appropriately enough, from Maroa Joseph, who poses a question which I think we've tried to address already, but let's do Joseph the honors by responding directly. The question is, how can governments justify continued donor dependence for NTD programs instead of integrating them sustainably into national health budgets? Sabina, you're nodding vigorously. You accept Joseph's question. Okay, how would you respond?
Well, it's great that Joseph's asking the question. I encourage Joseph and others to ask their own governments those questions on a regular basis. I think, as we've said during this program, it is really critical that we continue to support the local experts, which are governments, communities, healthcare workers in countries, to increase the capacities they've got, integrate into their healthcare systems, and make sure that they've got a sustainable future within the current healthcare environment. And as we've said before, we are supporting, yes, with the NFund, WHO, of course, but also we are working with some other groups to try and support ways to look at national ownership even more, because I think as we go past 2030, that's a point where it becomes absolutely critical, where these mass drug administration programs are going to reduce. So because there's not going to be a need for these big ways, we need to find a new model, a new sustainable approach. With, for example, working with the Liverpool School of Tropical Medicine to see what could that look like in rural Malawi, for example. Sorry, not Kenya, Joseph. And we're also working with Children Without Worms for STH to see what's a framework to transition for countries. What does that look like? The domestically funded programs look like. And I know we're not alone in doing that. This is absolutely critical, and I'm sure Sam can add significantly to that answer.
Yes, Sam, how would you answer or add to what Sabina has said? Because Maroa Joseph is waiting on you. And there's an edge to the question. How can governments justify continued donor dependence for NTD programs? And he wants them to step up.
Well, I think that's something that we would all like to see, but we have to also be pragmatic and think about the right incentive structures and the right kinds of partnerships to help make governments do that in thoughtful, more effective ways. And I think at the core of understanding those new structures and those new decisions and how partnerships are put together is better data. Data behind programs and understanding the scale, the coverage, the data around the effective supply chain of drugs and commodities, The data systems in place are not always up to the minute. They're not always as strong as we would like them to see. So the more investment we can see in data, and again, this is a big part of why we're thrilled that GSK is coming to the table in new ways, that part of their new collaboration with the N Fund is going to help to even strengthen data systems to better understand the scale and how we are optimizing and using the existing resources. Because only once we have a strong understanding of the scale of what is required and the resources available and how well we're using, can we then think about effective integration with other sectors. We can't ask another sector to take on work or integrate pieces of work without having the right data to back it up and to be accurate in measuring how effective and cost effective these kinds of new integration collaborations can be. So I think that's the only other thing I would add is that a focus on data is fundamental.
Tremendous. Thank you very much indeed. We have another question from New York. Uwami is there. Uwami says, greetings. Thanks for this wonderful podcast. Very informative and encouraging. My question is, would the delivery means of proposed solution be dependent on local governance of afflicted regions? Uwami is concerned about the integrity of local leaders to see it through without, this is an interesting construction, Uwami, without looking to interlace solutions with political popularity. I think Uwami is concerned that perhaps a local leader may adapt the delivery according to what is popular on the ground as opposed to the actual need. Is Uwami right to be so cynical? Sabina, what do you think about that? The delivery means dependent on local governance of afflicted regions. That's the question from Uwami.
Well, from my experience, I've seen that local leaders in communities really do want to do the best for the people in those communities. Now that's a very general statement, I recognize, and that can't always be the case. But this is where education, advocacy, and those people who have been able to move past having an NTD, who have received treatment or been a carer or have that knowledge, can really share and communicate more broadly in the communities that they're in and speak up if they are not getting the treatment they deserve. I'd say, in addition to that, there's been a lot of coordination from the WHO, from WHO Afro, from the Gates Foundation. And I know they are working top down, bottom up as well to understand what does good look like. So there's some great examples of what good means. And I'd say to Mwami, if they're not seeing what they need to see, speak up. This is a really important topic to engage with. Is it possible that some people are going to be looking for votes? Possibly. However, this is so much more important and we want everyone to speak out. But I think education, advocacy can help here.
Thank you, Sabina. Sam, how would you respond to Uwami's concern? And that's not the first time I've heard that feeling of concern.
Well, I would perhaps look at it a slightly different way and suggest that any local leader has a vested interest in improving the health and prosperity of their community. When I think about it, at the End Fund, I said before, we pool resources, we raise money from private and philanthropic sources, and then we make strategic grants with that money to best support the optimal elimination programs on the ground. And a key part of what optimizes the delivery is the involvement of local leaders. We have many communications assets, videos. We've an award-winning documentary film available on our website that actually speaks exactly to this point, the importance of local leadership. And I think we can look at leadership in a really wide variety of ways. I do hear the concern about the conflation of political ambition or agendas with, co-opting health programming. But from a broader perspective, you can actually say that every local leader is critical to effective program delivery. So when our programs team are looking at making investments, they will absolutely be looking at which local leaders can be mobilized to help to socialize the idea of a mass treatment program coming to a community. And very often, it's actually local leaders, be they political leaders, be they faith leaders, business, even leaders from the local school. It could be a school principal or a teacher. They're the first ones to take the pill. And they do it in front of everyone to show everyone this is safe, this is good for your health, and this will improve our community. And so, actually, local leaders have a hugely positive role to play.
Thank you very much indeed, Sam. We're coming to the end of our broadcast, and I'd like us to wrap it up by answering this question. Oh, let me put this question to you first, Sabina. What story or lesson would you like to share with our audience as a final takeaway? It's World NTD Day. Let's remind people why we're doing this, or where do you think our efforts are most needed right now in the fight to end NTDs?
Well, I think all I'd say is they're called neglected tropical diseases, but they should not be. We need to rally together and make sure it's not just 21 countries to eliminate LF. It's not just those thousands of people who have gone through the other side, but there's all those thousands of people out there who need us to work together. They need us to come together as one group and become a force for good, and making sure that when you're talking to people you know in your communities, with your governments, with your partners, with your friends, make sure you're asking them, what is it that you're doing today? Have you thought about becoming a philanthropist? You speak to the End Fund. Have you engaged with your organization to see what they're doing? And how are you making sure that everyone out there has access to the treatment that already exists, and hopefully additional treatments that exist in the future, to make their lives better and have a healthy population as a whole?
Yeah. Sabina, thank you very much for that. What about you, Sam? What story or lesson would you like to share with our audience as a takeaway?
Well, I hope everyone by now knows where we are in the journey to eliminate NTDs, and that it is in fact possible in our lifetimes on our watch by 2030. We know we have the tools there. And I think I said it before and I'll repeat it for the final word here. It's that the biggest mistake that we can make and the biggest risk facing us now is to stop too soon. We know that many donation programs are set to end just as elimination milestones are actually going to happen around 2030. And history is very clear. It shows us that if we pull back too early, if we take the foot off the gas too early, diseases can come roaring back very quickly indeed. Decades of progress can unravel very quickly. And so we need to finish the job, but that requires all partners to stay the course. It requires us to celebrate more and encourage more pharmaceutical investments and donations, but it also requires the rest of us to coalesce and partner in different ways around those to better leverage the stable and the scalable partnerships and assets that we have at our disposal today, when the rest of the sector is looking less stable. So staying the course is critical, and being open to change and supporting governments.
Yeah. One final supplementary, which either of you can choose to answer or ignore. I'm wondering, what is the difference between those countries which have managed to end at least one NTD, and of course we want more, and those countries who, or which for whatever reason haven't quite managed to get there yet? As I'm looking at you, Sam, I mean, would you want to respond to that? Because there might be broad trends that you've identified.
Mm. Well, I think we have covered some of those reasons, and the political prioritization is critical. But knowing how to do that is very context dependent on the time and place and the context of the politics in any given country. So it's not to say that's an easily replicable thing, but I do think it's been critical in countries like Togo became the first country to eliminate four NTDs, for example. And the level of commitment there from the government to achieve that is, almost unprecedented. It was really incredible. But thinking about drawing the lessons from that and then applying them to the context of today, I think is very important about how we
Yeah.
adapt and best support our government partners.
Final thought from you, Sabina, on that?
Leadership is critical. We
Right.
need people to make a difference. We can do this. We can eliminate NTDs.
Tremendous. Thank you very much indeed. What an excellent way to wrap up what I think has been an outstanding hour. And I do a lot of these. This was truly excellent. So that's all we have time for. Thank you once more to our guests today, Sabena Solomon, Vice President and Head of Global Health Access at GSK, and Sam Macintosh, Vice President of Global Strategic Partnerships at the End Fund. And a big thanks again to the Gates Foundation for supporting today's event and helping to bring this critical topic to you, our live audience. Next week, we'll publish the podcast version of this conversation, which we're releasing as a bonus episode on The Threshold. If you'd like to hear more from The Threshold and follow the podcast, you can visit our website at forumpolicy.com/podcast/the-threshold. It also has links to the podcast platforms. And if you're a fan, we'd love to hear from you. Feel free to email us at podcasts@forumpolicy.com. Finally, a very big shout out to the FP events team. They produce an amazingly broad range of events throughout the year. They're also at many of the major convenings, including the Munich Security Conference, World Health Summit, the UN General Assembly, and others. Check out Foreign Policy's other upcoming events at forumpolicy.com/events. Take care and see you soon.